name is Joan. What's your name? Hi, Lauren. How old are you? 13. Well, thank you, Lauren, for coming in. You're here for a cardiac peripheral vascular assessment. So at any time do you feel uncomfortable, just please let me know and I'll stop. I'm going to inspect. I'll be touching you in certain areas and I'll be listening to heart sounds with the bell and the diaphragm of my stethoscope. So it's going to be a repeat of several steps. Don't feel alarmed. Um, it's just the process of listening to the heart sounds with the bell and the diaphragm. So if you feel uncomfortable at any time, please just let me know. Do you have any questions? Okay, let's get started. So we're going to start with the arms. I'm inspecting your arms. I'm looking for symmetry of hair distribution. There is no edema noted, and I'm looking for color. Like I said, hair distribution is symmetric. Arm length, color is symmetric. I'm going to palpate for temperature. It's warm to touch. There's no edema anywhere on the arms. I'm looking at your capillary refill. That's pressing of the fingertips, watching it turn white, and then it uh, returns back to a pinkish color. That means blood is refilling in the fingers. I'm checking the skin turgor. That's the elasticity of the skin. I'm also checking your grip. Grab my fingers, please. Good grip. Again, capillary refill, turgor. Everything is symmetric bilaterally. Hair symmetric bilaterally. So now I'm going in to inspect the neck, the carotid and jugular area. I don't see any extensive pulsating of the carotids. Nothing noted bilaterally. I'm also going to inspect the carotids. I need you to take a deep breath and release and then hold your breath. Okay. Again, deep breath and hold. Okay. So I'm also going to listen with my stethoscope. Let me get that cleaned up for you. Again, I'm listening with the diaphragm, which is the bigger size of the stethoscope, and the bell, which is the smaller size. Okay. Again, deep breath and hold. Again, deep breath and hold. Okay, and I'm listening with the bell. Just have to flip it around. Deep breath and hold. Again. Okay. So right now I'm going to inspect the precordium area, which is typically located between the first, second rib, depending on the person, and to the fourth or fifth rib. I don't see any pulsations. I'm now going to listen to this area and identify the areas that I'm listening to. I'm listening with the diaphragm first. So we're going to listen to the aortic, which is second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, lower left sternal border. And mitral, which is the fourth to fifth intercostal space, mid-clavicular. I'm also going to listen with the bell again. Aortic, pulmonic, Erb's, tricuspid, mitral. Now I'm going to have you lay down on your left side. I would like to listen to your mitral valve and kind of lean forward for me so I can get a good feel of where it is. It's mid-clavicular. I'm listening with the bell. Mid-clavicular, fourth to fifth intercostal space. I'm listening for an S1, S2, which is like a lub dub sound. Okay. Now flip over on your back for me, please. All right, so now I'm inspecting the precordium area. I'm also palpating this area. Okay, gonna palpate with the right hand, the palmer of my hand. Okay, we have aortic, pulmonic. Get in there. Herb's point, tricuspid. It's best in that intercostal space with the finger lateral to the ribs. Okay, I don't see any visible pulsations of the neck of the carotid or any jugular distension of the neck while you're lying down. So now we're going to move down to the pulses. So right now I'm inspecting the legs. Legs are symmetrical in color and hair distribution. There is no visible varicose veins. I am palpating for skin temperature, no edema of the legs. All right, so let's go back to the pulses. Inspection of the femoral pulse bilaterally, popliteal bilaterally, posterior tibial bilaterally, and dorsalis pedis bilaterally. All pulses are good and bounding. So do you have any questions for me, Lauren?
No, ma'am.
Okay. So like I said, I inspected every the precordium area. Yes, thank you. You can sit up. I inspected your precordium area and thank you for coming in.
Yes, sir.
I am here to give a report on Lauren, age 14. The upper and lower extremities were found to be warm and dry bilaterally. The hair distribution and color was symmetrical. The turgor was elastic, grip was strong bilaterally, and equally capillary refill was less than 2 seconds bilaterally. No edema or varicose veins found in the lower extremities. No pulses were found to be equal bilaterally, upper and lower extremities. The carotid pulses were found to be equal and bilateral with no bruits noted. The precordium palpation found no extra pulsations or uh, palpation of extra heart sounds noted on palpation or auscultation, no visible pulsations of the heart. The apical was found at the fourth intercostal space, left mid-clavicular. All areas were palpated and auscultated with the diaphragm and the bell with a S1, S2 noted and no S3 or S4 noted. Thank you.